Today, I would like to discuss the United States healthcare system and the problems associated and what we can do to solve those problems and make it more affordable. Now, we all face ups and downs in our health, but as a U.S. citizen, do we really need to pay as much as we do now? I personally have Medicaid insurance, which is provided by the government, but I still have lots of co-pays, and there are medications that cost anywhere from $50 to $100 at a time. And on a fixed income, as I am, that is just way too much. We spend overall way too much on healthcare in the United States, and there has to be a way to get decent care while paying less. So let's explore the United States healthcare system. Now, healthcare in the U.S. costs a pretty penny, and many citizens struggle to keep up with the cost of surviving. According to the CommonwealthFund.org website, the U.S. spends more on healthcare as a share of the economy, nearly twice as much as the average OECD country, yet has the lowest life expectancy and highest suicide rates among 11 nations in the OECD. And there are many obstacles that contribute to this overspending. The United States has the highest chronic disease burden. We have a short supply of physicians, and we use overly expensive technology, which is often promoted by the physicians. Now, even with advanced technology available, the United States falls behind on care quality and availability. Also, according to CommonwealthFund.org, compared to peer nations, the United States has among the highest number of hospitalizations from preventable causes and the highest rate of avoidable deaths. The healthcare system, according to ncbi.nlm.nih.gov, the healthcare system is too unreliably structured to cover citizens sufficiently. It's apparent that the system is faulty to a U.S. citizen, but allow me to break it down a little further for those who aren't U.S. citizens. Our healthcare system is poorly structured overall. According to Harvard.edu, access to United States healthcare is uneven. Employment can dictate access to insurance, and losing your job or being laid off can cost you this insurance, meaning you're left out in the dust, uninsured. Insurance companies, being mostly privately owned, can choose to decline necessary coverage to keep rate costs lower, leaving covered clients in the dust. And investments in U.S. healthcare seem misdirected, according to also Harvard.edu. Doctors and insurance companies will often bypass simple solutions for injuries and illnesses to instead promote the use of drugs and operations because they get a share of the cost of that. And due to lack of insurance coverage, many innovative and more simplified forms of healthcare are stifled. There's more to consider than just insurance companies and cost alone, though. According to HBR.org, the U.S. healthcare system is not built for primary care. Primary care doctors are not considered subspecialists. Due to this, primary care doctors don't have the sophisticated and innovative tools that subspecialists have at their disposal. And the industry revolves around process-based care rather than solving the real-life problems patients face due to injury and illness. And we pay based on quantity of care rather than quality. Our healthcare system runs on a fee-for-service system, meaning doctors get paid a lump sum every visit and isn't outcome-based. Gaps in quality contribute to higher costs due to more doctor's visits to try and solve the core issue. Now, these are some hefty problems, but can we find a way to solve them? Our solutions are increasing coverage, lowering costs, and ensuring quality care. And these are all just beginning steps to transform our system into a healthy one. Now, capping costs for private insurance companies and promoting them to localize coverage is a way to have more coverage and more access to coverage. And capping life-saving medication and procedure costs, like considering the EpiPen can range anywhere from $200 to $1,000 depending on where you live. You know, this is a life-saving emergency medication that we're having to pay way out of pocket for if you aren't covered by insurance. And evaluating pay rates based on patient outcomes and annual reviews of offices rather than just a fee for service. So we're actually looking at the success rate rather than just going through the motions. Our healthcare system is below subpar, but we can slowly but surely fix things. Our system is plagued by high costs, low rates of coverage, and low quality, high quantity care. Reform is what we want, and what we as humans and citizens of the United States need.